And I'll also mention, because I'll probably forget otherwise, I have placed some additional literature on the table back there with your name badge holder. So if you're interested in more information from the Alzheimer's Association, there's several brochures there on different aspects of the disease. Just pick something up on your way out. Okay, it looks like we're got it together slide-wise. And what I always like to do is preface my remarks with a little bit of information as to how or why I am doing this, since that may be a question in your minds. And Gary has kind of already detailed my bio and the fact that I was on faculty in the School of Pharmacy for many years. My area of interest in pharmacy has always been aging and older adults. And so a lot of the teaching I did had to do with drug therapy in older adults, including, of course, dementia and Alzheimer's disease, since that is primarily a disease of older individuals. So that got me involved from that professional aspect, in addition to the fact that some years ago, I started doing consulting work and served as a pharmacy consultant to a couple of different long-term care facilities here in the Missoula area. Pharmacy or nursing homes are required to have a pharmacist who comes in at least monthly and reviews drug therapy and whatnot of the residents. That got me some very close-up personal look at individuals with Alzheimer's disease. And then it got even more personal when in the late 80s, my father turned up with Alzheimer's disease. My parents were living in Washington State, and my mother finally agreed or decided that they needed to get closer to one of us. There were 3 daughters, and we brought them over to Missoula. We did spend the next 9 years, I guess, with my father going through that disease process, which is a process, and got an even more in-depth look at it. Most recently, Tim's mother, and I was supposed to introduce my husband, Tim Edwards is here with me this morning, has developed Alzheimer's disease and is in the late stages of the disease, luckily at home on hospice and not in a long-term care facility, given everything we've gone through just recently with the pandemic. So again, I've had a lot of personal experience with the disease as well as professional opportunities. So what we're going to talk about today, though, is not so much about the disease itself, but how one might go about, I hate to use the word preventing it, but minimizing your chances of developing it. In talking to a lot of different people, and in fact, a few years ago now, I was able to make a trip to Anchorage. It had to do with the grant, and we were meeting with a group of individuals up there that were working on similar issues that the Montana Geriatric Education Center that I work with was handling. And I got to have lunch at a native Indian or the Alaskan, get the right terminology here, Center for Older Adults. And I sat at a table with about a half a dozen Alaskan natives for lunch. And the one concern that they had, that they talked about, was dementia. It was on their minds just as much as on everybody else's mind that I've had contact with. It used to be, I think, we feared cancer. You know, the C word was the big fear, and it still is. It's a very fearsome disease, but I think more people perhaps even fear the loss of memory and the process that one goes through as they go through that disease. I would say that a lot of what I talk about today is very applicable to this crowd, even though we're all in our advanced years. It's even more applicable to your younger friends and relatives and family members. If you can leave here and plant some seeds in their brains in terms of what they should be doing, that's all the better. So what we're going to talk about, and let me get the computer terminology here going. Our learning objectives that we're going to address today is, of course, reasons for taking care of yourself as you age, and I think you're probably all well aware of that. The interesting thing is that just in recent years, they have come up with a number of risk factors for Alzheimer's disease. A lot of research is going on in this area. And I'm actually going to, I don't know if I have enough copies for everybody, but I have a brochure that I'll pass out here in just a second that has a interior folds have about 10 different things that have been found to be important and may impact your risk for the disease, for developing the disease. And that's everything from exercise to protecting your head, protecting your brain, physically, mental health, sleep, socialization, not smoking, et cetera, et cetera. And so we're going to focus today on 4 of those, and that's the physical health and exercise. Second here, I don't have enough hands. Diet and nutrition, cognitive activity, and social engagement. And it mentions a workbook. I want to pass some down each side. A workbook that I don't have copies of here today, but if you're interested, you can go on the Alzheimer's Association website and access that workbook, which is a handy way to actually create your own plan for healthy aging if you were interested in doing that, or passing that on to somebody else who might be interested in that. Just a little general information to start with. The how well you age is really dependent on a number of things. And of course, the first one you have no control over. While there's some very common signs of aging that we all exhibit as we gather here today, the loss of hair color, the wrinkling of skin, the changes in the loss of hair, the changes in eyesight, so that we all need those progressive lenses. While all of those are more cosmetic changes, we also, through our genes, have the development of different diseases and the just general control over the aging process, which we don't understand. We don't know what controls that, to be honest, but it does. We're pretty certain there's genetic influences on that. The other issues here, or the other factors, would be the environment that we live in, and then the lifestyle that we choose to live. And these are definitely 2 areas over which we have a lot of control, and it can make a big difference in terms of how we age. And so we're going to be talking a lot here today about lifestyle choices as we talk about this brain health topic. Again, information here that I don't think is news to any of you, but in terms of the brain and its importance in the body, it's a control center made up of neurons or nerve cells, many of those that have a very large branching network. And as biochemical transmitters travel from one nerve cell to another, we transmit all of the activity of the brain. So everything from forming memories to speaking and moving, and just you name it, it is controlled there. Unfortunately, with Alzheimer's disease, this structure is basically destroyed. And it starts out in a fairly benign fashion, and it probably starts out 10 to 20 years before there's any symptoms. So many of us in this room may already have the development of amyloid plaques and what we call tau protein tangles. Plaques and tangles are the hallmark of the disease when autopsies are done, or if that would be the major opportunity to look at brain tissue. That is what is seen as the primary indicator of this disease being present. And of course, as those plaques develop and the tangles are produced, then the function of the brain is less and less efficient and finally destroyed. The thing that we've come to find out is that there is a real connection between the heart and the brain in terms of what's good for the heart is also good for the brain. And the main interrelationship, you might say, or relationship would be that in order to function, you need oxygen throughout the body, and particularly to the brain. with each heartbeat, about 25% of the blood flow does go to the brain. So it's extremely important that we have good heart health as well to maintain that healthy brain. And we're working then towards all those same factors that you've heard about for heart health. Just a couple of words about dementia. Dementia is a generic or an umbrella term. There are many forms of dementia. There's actually probably 15 to 20 different kinds of dementia. Alzheimer's is the most common, and about 60 to 70% of all cases of dementia are Alzheimer's disease. But there's also the other three big ones that you may be familiar with or you may have heard of. Vascular dementia, which is common in people who have cardiac disease, heart disease of some kind, may develop, are more likely to develop a vascular dementia. Something called Lewy body dementia, which is related to Parkinson's disease, not directly, but there's definitely a connection. And it's sometimes said that people with Parkinson's disease often will develop a dementia in their later years towards the end of life. If they present primarily with neurological symptoms and problems of the brain, then they often have Lewy body dementia that often progresses to Parkinson's disease. So there's very definitely some connections there. And then there's something called frontotemporal lobe dementia, which is a disease that often sets in younger individuals in their 40s, 50s, 60s. And actually Alzheimer's disease can present as early as the well, 40s is really uncommon, but 50s and 60s, but it is primarily disease of age. And our risk for Alzheimer's disease increases steadily as we age. Genetics plays a role. If you have a first-degree family member with Alzheimer's disease, like my father, I have an increased risk. It's not on this list, but sex plays a role in that females develop Alzheimer's disease more often than males for reasons we don't understand. And it's not just the fact that we live longer, but it does seem to be related to probably hormonal influences. There's a lot of research again going on in that area, but we don't know exactly what the connection is. Head injury is a factor. Oh, trying to get my head, speaking of heads. Thank you, I wasn't paying attention. Head injury is a factor, and you're all aware of the problems, the connection with football players and concussions, fighters, you know, that have had a lot of head injury due to their boxing are at higher risk. We do see an increased risk in people with cardiovascular disease, whether that's high blood pressure that's not been adequately treated, or diabetes, which has a lot of heart disease associated with it. And then there's some kind of outlying things that we don't, again, fully understand, but even such things as that fewer years of formal education. The more education an individual has, the lower their risk of Alzheimer's disease. And whether that's related to the fact that with more education, you develop more brain reserve, more capacity. And so it takes longer to lose that. We, again, don't understand why, but that's just an observation that has been seen. The heartbreaking thing probably about this disease, at least at this point in time, there really is nothing that can be done to treat it and certainly to cure it, not to cure it as the disease progresses. And I'm sure have some questions at the end about the new drug that's just been approved, but even that drug therapy, while it shows promise, is not necessarily the final answer for what we need to really control this. Could spend a whole hour just on that, but we will move on to the topic at hand, which is the need to take care of yourself as you age. And as I mentioned, we're going to function on 4 of those factors that are in that brochure that I passed around. And that would be the physical health and exercise, diet and nutrition, cognitive activity, and social engagement or socialization. Those are the 4 that we probably have some of the best data on and the best connections of those being able to reduce the risk of Alzheimer's disease. If we look first at that, excuse me, at the area of exercise and physical activity, this is the one area where the research, I think, is the strongest to show that there is a real connection between staying in good condition, not becoming sedentary and out of condition as you age. And the connection with the brain, again, there's not fully understood, but it's probably related to blood flow and the fact that as you exercise and as you maintain a healthy weight and good cardiovascular condition, you do have adequate and sufficient blood flow to the brain that helps to preserve function. There's not good agreement on how much exercise, what kind of exercise, and how you should exercise. There are those who believe it has to be vigorous and it has to be aerobic and you have to get that heartbeat up and keep it up for a certain amount of time. There's others that say walking is sufficient as long as it's done regularly and an adequate amount. So we don't have a formula. We can't really apply anything specifically. But I think if you go with the current recommendation, which I think is for 150 minutes per week, 30 minutes a day for at least 5 days a week, and trying to get that heart rate elevated for at least part of that time, that is good thing to shoot for. Some of the things to remember or to keep in mind about exercise. I'm someone who does not like to exercise. My husband will attest to that. I am not a gym rat. I have never been a gym rat. And I admire those who do that, but I can't do it. I have a neighbor that I swear, when I got up this morning, her car was gone. I'm sure she was at the gym because that's what she does every morning. But it's not me. And I primarily am a walker and try to get out to walk, but I don't even do that really regularly. So it is so easy to say you're going to do it, want to do it. You know it's the best thing for you, but it's hard to get it done. So these are some hints of how to go about that. It's got to be something you like to do, and you need to start out small, of course. Always be safe, and primarily in the context of head injury. If you're biking, you're skateboarding, or maybe you're on one of those scooters, or whatever it is that you might like to do, wear a helmet. Skiing, wear a helmet. You see the kids out there with helmets on. There's a good reason for that. And for the older adults that are out there, we should have them on too, because head injuries are a very real possibility and they are a risk factor for dementia and memory loss. If you need to get your heart rate up, as I mentioned. And this is one of the ways where we can also incorporate another of the risk factors, in that if you do this with other people in a group and make it a social event, you get that socialization in, which is another important factor. And so while walking alone is fine, if you can join a group or be in a group, or even just another person, that's a good thing to pursue as well. And that may also get you out doing it regularly, as opposed to making it easy to put off. In the area of, let's see, I had it up here. Did I make it with my water glass? Is that? Can you bring me a water glass? I thought I brought it up here. Thank you. I meant to bring it up. In the other area of just general physical health, there's a lot of things on this list that I'm sure are familiar. Smoking is definitely a risk factor for dementia and development of memory problems in later years. Excessive use of alcohol. Moderate, minimal, low use is fine, but excessive alcohol, of course, is problematic. We're more and more information now on the value of sleep. And there's just recently been some articles published in the medical literature on the fact that the brain actually, as they were some referring to it jokingly as sleep allows the brain to wash out the toxins and to kind of regroup and be ready for the next day. But there is fairly good evidence that sleeping is important. And the recommendation is around 7 hours, at least it's around 6 to 7 hours of sleep per night is a minimum that one should be shooting for. We talked about head injury, stress as well. It's hard to really identify the impact of stress on brain health. Management of stress is important for our quality of life, if nothing else. And depression is another risk factor for dementia. And so if depression is untreated and prolonged, that is also problematic. Having medical care and visiting your physician regularly for checkups is another important factor. Those of you who have, not all offices are necessarily doing this, but the Medicare annual wellness visit is a time at which a screening is done for not only cognition or memory problems, but also for depression. And so that's a time that's recommended to see your physician annually and have those checkups done. I should also mention, it's not on this list, but I should also mention that medication can be a problem. And so it's important that somebody, pharmacist, physician, be reviewing your medications on a regular basis to make sure that if you are experiencing memory problems, there might be a medication reason for it, or you may be on medications that can predispose to memory problems. We now have some fairly good evidence that drugs with a strong anticholinergic activity do predispose to development of dementia. And that includes, it's a big word for some very common side effects, but if you think about anything that makes your mouth dry, maybe blurs your vision a bit, maybe causes a little difficulty with urination, or may cause constipation, these are all anticholinergic side effects, or they can be anticholinergic side effects. We warn people away from Benadryl. Older people should not be using Benadryl, particularly for sleep at night, because is a strong anticholinergic side effect with that drug. It does put you to sleep. It also increases your fall risk because you may have some morning hangover from it. And you also may, if you do get up at night, are higher risk for a fall. So there are some medication issues. And again, I could probably spend an hour talking about those, but that's not what I'm here for today. Know your numbers. And hopefully everybody in the room knows what their blood pressure is, what their blood sugar level is, or your hemoglobin A1C, of course your weight, and then your cholesterol level. Out of these, cholesterol is the least high risk for dementia or for brain health. There's some thought, but no strong connections there. But certainly we do know that people with obesity, we know diabetics and people with high blood sugars, we know people with uncontrolled blood pressure are at risk for the development of dementia in their later years. So know your numbers and keep them under control. I think I'll wait and just ask for questions at the end, and I need to get my wrist around here so I know how I'm doing on time. The diet and nutrition, again, this kind of ties into heart health, so that we want to be sure that we're providing the body with enough and the right nutrition to maintain all of the organ systems, including the heart and the brain. And there's various dietary guidelines out there. Probably the one that is of most specificity for dementia is something called the MIND diet. I don't know if you've heard of that. It's MIND, just MIND diet. And it's very similar when you look at it to the Mediterranean diet, if you're familiar with that one. But it is a good idea to be at least aware of those diets and to try to follow those as closely as possible. What they have in common, and this is really probably both the Mediterranean and the MIND diet, but the high use of fruits and vegetables. And with the MIND diet, green leafy vegetables are the preferred ones. All of those spinach and kale and good things that my husband's making faces about are the best for you. Fruits in general are great, and berries are the best. So if you're a blueberry consumer, you're in business. All the nuts, all the legumes or beans, whole grains, all of those things are great components. Meat and dairy are to be used in moderation or minimal as possible, which is disappointing to me because I'm a milk drinker, but I do drink skim. So low fat if you're going to go dairy, and minimal red meat, fish and poultry is fine. And then olive oil is the recommended oil to use. And then of course the avoid list is all the good stuff that we'd like to eat all the time. But as much as you can follow that diet is the better in terms of heart health and brain health. Moving on, just a few tips there, and the need for dietary supplements and vitamins. Honestly, with the American diet, if you're eating a good normal diet, you don't really need vitamins, but it's certainly something to talk about with your healthcare professionals. Your physician or a pharmacist would be able to help you as well. There really is nothing out there at this point in time that has been found to help prevent Alzheimer's disease. And that includes all of the dietary supplements and herbals and other stuff that you see advertised. I regularly have a conniption fit when I open the Missoulian and I find a full page or at least a half-page ad on some unproven, unknown garbage product that is being promoted for brain health. And it's just, the best thing is probably not going to hurt you. The worst thing, it's going to hurt your pocketbook. But there's a lot of stuff out there, and there still is no good evidence that any of it really does anything. So just buyer beware, and talk to the healthcare professionals or the dietitian or somebody who has some knowledge in that area if you do have questions. Moving on to cognitive activity. We do know, again, I mentioned that years of formal education are a risk factor for the development of dementia. And the more active we can keep our brains, the better off and the lower the risk, we believe, of developing dementia. At one time, we thought that once your brain was fully formed at, say, your adult age, that was it. You had all the brain cells you were ever going to have, and nothing, all you're going to do is go downhill and lose them. We now know that the brain possesses something called neuroplasticity, and that's the ability to develop new connections and new function or additional function of the brain over time. And thus, the more you can challenge yourself and challenge your cognitive ability, the better off you'll be in the long run. Again, there's not good disagreement about, a lot of disagreement about what this should look like. I'm a crossword puzzle fan, as my husband will attest. And admittedly, the Missoulian crossword takes me about 3 to 5 minutes to finish. It's easy, it's fun, but it's probably not doing a darn thing for my brain. But of course, I do it every morning. The LA Times, which I think is the one that I usually work on in the Sunday paper, is a lot more challenging and probably a lot better for me. So whatever you choose to do, make it as difficult as you can. If it's reading, reading's great. The more challenging the material, the better. If you're a Molly participant, that's fantastic. Get out to those Molly courses and read the books and participate in the discussions. They encourage you to take up a musical instrument or learn a new language. I have a son who, now lives in Scotland, but I always was going to learn how to speak French while he was living in France. Of course, I never did. But, there's the kind of challenge that they really think is the best challenge. But it's important to keep the old brain active and working as we get older. And I probably just said all of this. So skills and hobbies, engaging in ongoing learning. That last one, risk factor that we're talking about this morning, is the one of social engagement. And a couple of years ago, they came out with a interesting statistic that, and this was prior to the pandemic, interestingly enough, that social isolation was the new smoking. And people that were isolated and lonely, living like that was equivalent to smoking 15 cigarettes per day in terms of the impact that it has on your overall health. Now, obviously, you might not have the same outcomes with smoking. You may get lung cancer. With the social isolation and loneliness, the problems that ensue that lead to morbidity and mortality are different, but they still exist. And of course, then came the pandemic. And here, then we created social isolation for almost all of our older adults for a good year plus. And who knows what that impact had, particularly in the long-term care facility, where there was already a high death rate due to exposure to staff primarily that were bringing in the disease, and probably family visitors as well, until they cut that off. But we isolated everybody. We put them in their rooms and they were not allowed to leave. And that in itself probably contributed to a lot of the deaths that we saw in those facilities. So we've had a really good lesson over the past year as to what that does. They think some of that with social isolation, people tend to suffer an increase in chronic inflammation, and that can affect many disease states, not just the brain, but it does, inflammation does play a role in Alzheimer's disease, and it is probably the mechanism by which this has an impact. So as we're pursuing all of these different things, we need to keep in mind that social activity is really important. Family, friends, however we achieve that. And if we can combine that with our cognitive, with our maintaining our cognitive activity, if we can combine it with our physical activity, however we can combine it with our nutrition, getting out to eat with people, those are all ways that we can bring in social engagement as we're and of course, I'm getting ahead of my slides. Volunteer work, joining groups and clubs like this, these are all great ways to have that social engagement. Putting that all together then, you can see the maximum, the idea of maximum benefit. And they've actually, there was at least one study I remember reading, and I don't remember now where it was published, but they looked at individual benefits of these individual activities versus the combinations. And we're able to show that there was synergism, there was greater benefit in people that were pursuing more than one of these at the same time. Of course, many of these interact, so it would be hard to just limit yourself to a single one. Again, I know I'm preaching to the choir, but here's some tips on what you can do is having a plan, getting started, keeping it small and something you can do and you will stick with it. And it should be something that's fun and that others hopefully can work with you on it. I did talk a little bit about all of the products on the market that are promoted for brain health. And as it says here, if it sounds too good to be true, it probably isn't true. You do need to have a great deal of what I call healthy skepticism and look things over carefully before you. I don't know how many people have asked me recently about Prevagen. Everybody heard of Prevagen? It's a product out there. Nothing. If Prevagen had anything going for it, the physicians, every physician in the country would be recommending it, and the pharmacists, and so be cautious and be careful when you're examining these different remedies that are promoted. And of course, you know who you can look to for information. I do want to save some time for questions, so I'll just speak very briefly about Alzheimer's Association. They do have a wonderful 24-hour, 7-day-a-week helpline that a real person answers the phone. You won't get transferred from one voice to another. So if you ever have questions or you know somebody who is struggling with memory problems or has a family member, this is a wonderful service that you can use in the middle of the night when something comes up and you don't know what to do. These programs, similar to the one that I'm presenting here, are available on their website. And so you can go on to alz.org and find all kinds of educational material for anybody who might have questions. There's areas on the website where you can plug in your zip code and it will tell you everything that's in your area that's available, the support groups, the educational sessions, that sort of thing. And it also has areas where people can blog and share message boards and blogging capabilities where individuals can interact with others if they need that kind of support. And then a navigator, which helps you develop a plan if you're actually dealing with this with a loved one, and what all you need to consider and what you need to do, everything from safety to legal issues to caregivers, et cetera, et cetera, et cetera. Locally, we do have a lot of things going on. Gary mentioned Dementia Friendly Missoula, which is an organization that is affiliated with Missoula Aging Services. And we've been working now for about 5 or 6 years. In fact, I think the last time I was here, I was talking about Dementia Friendly Missoula, trying to make Missoula a dementia-friendly town. And that is one where people with dementia or with memory problems prior to maybe the actual diagnosis are comfortable and do receive support throughout the community. The museum has a monthly art in the moment class that is intended for people with early stage dementia and their caregivers. The library similarly has their memory cafe, which meets monthly. And both of these have been remote. I don't know when they're coming back in person, but these are both great opportunities for individuals who have family members who need to get out, need to be able to do something, but maybe can't go into the mainstream activities in the community. So questions?
We'll repeat it.
Okay.
Go ahead.
Okay. I was reading an article about physician-assisted suicide in the New York Times Magazine recently, and they spoke of a dilemma. People want to take that route, and it's very much legally constrained. There's a lot of rules for it, but they want to take that route to avoid pain and suffering, mental and physical, at the end of their life. Well, a real problem developed with dementia in that you can only select an optional end of your life if you have all of your mental faculties, but by the time you get into dementia, you fail that test, so nobody can exit that route. That's an ethical dilemma. Do you have any comments on that?
I'll repeat the question for the group in here. And he's asking about assisted suicide, physician-assisted suicide for dementia patients. And the fact that in order to participate in that, you have to be in full, judged to be, I think it depends on the state, but even sometimes as many as 2 different physicians to be in full control of your faculties. And of course, as a dementia patient, you are not. And so the dilemma becomes, if one wanted to use that option with the diagnosis of dementia, what and how. And I have also read a little bit about that, just watching it come through the literature. And keep in mind now, I'm not a physician, so I'm not speaking as a physician. It's more of a lay opinion. But the gist of what I understand is that, and this actually does happen. There was a paper published recently about suicide in individuals with early onset, not the early onset type of dementia, but early stage dementia, who recently had a diagnosis and chose to commit suicide rather than to go through that process. And that's kind of the dilemma that we're in, because once a person loses that capability, which is fairly rapidly in dementia, then they no longer are eligible, you might say, to participate. It would then be basically being committed by the caregiver or whomever was, committing the act. So yes, there is a huge, you might say, ethical dilemma and a huge problem with that. And probably no good answer to that question. You had a question. You're asking the wrong person. In case anybody didn't hear that, it was going back to the comment I made earlier about Prevagen and if it helps and how much does it help. And my comment is, I realize I'm a pharmacist and I have some knowledge about those kinds of things. I don't believe in them and I don't recommend them. And as I said earlier, if it really did anything, it would be, somebody would have figured out a way to really make a lot more money off of it than they are off of Prevagen. So, sure. Mm-hmm. Oh, okay. Yeah. Yeah, someone is commenting on the fact that drug interactions are a big problem and the lack of an agency. I assume you mean somebody like right, right. Yeah, there probably, I would agree, there really isn't any one group that's charged with that information. There's many groups, university groups, drug companies, nah, probably not so much, but there is a lot of research that goes on drug interactions and a lot of literature that's published. The benefit or the biggest way or the best way I think to work around that is to have a pharmacist that you know and you trust who has all of your information. And every pharmacy now is computerized. Every pharmacy with a computer has a drug interaction screening program, and those are pretty good. And they will pick up any of the drug interactions that are known. And of course, not all of them necessarily are known and documented as of yet. We find out more every day, but there is a lot of information out there. And if you have someone that has your information and can run those screens, does run those screens every time you have a prescription filled, actually, then you can get that information from them. I know many of you, or some of you at least, maybe are locked into mail order pharmacies where you may or may not have that relationship, and you may not have a pharmacy here in town, for example, that has all of your information. There is a program on the web. There's many programs on the web, but the one I like the best is drugs.com. So it's just www.drugs.com. They have a good drug interaction screening program where you can plug in all of your drugs and run a screen on them if you are concerned about drug interactions. That drug is aducanumab. It just was finally given FDA approval last week. I can argue on both sides of that coin. The Alzheimer's Association position is very much in favor of bringing it to market, and they lobbied very hard, along with many others, to get it approved and have it available to treat Alzheimer's disease. The other side of the coin that has led to resignation of advisory panel members that actually studied all the aspects of the drug and reviewed all of the clinical studies that have been done, thought otherwise. And in fact, last fall, I think it was last fall, maybe it was after the first of the year, they made the recommendation to the FDA that it should not be approved at this time. There needed to be more study. And the FDA went the other direction, which they have the ability to do so. The problem with that drug, it is a new entity. It is what we call a monoclonal antibody. And those are 10 plus years ago, as I was watching these begin to come on the market, I thought, I don't know if I said it, but I thought, you know, another decade or two, everything is going to be either a monoclonal antibody or something similar. We've really gone in that direction of drugs that impact the immune system in some way. So this is an example of that. There is another one in the wings. Lilly has one called donanemab, I believe, that's in the marketing process. They haven't gotten it to market yet. And I'm sure there's a host of others just waiting in the wings. And these are pursuing the amyloid hypothesis. I talked earlier about how amyloid, which is actually a normal body protein, but when it accumulates abnormally, then we get into problems. And that's what accumulates in the brain with Alzheimer's disease. These drugs impact that and decrease the quantity of amyloid in the brain tissue. And that should be good. That should, you know, be what we want to see in people who are starting to have problems with cognition. Unfortunately, they did two studies, at least two really good in-depth studies on this drug, both of which were discontinued because they were failed trials. They were not producing any good results. And I think that happened in 2019. Biogen then went back in and reanalyzed the data and came up with an arm of the trial that did show benefit in a very narrowly defined group of patients at a higher dose. Unfortunately, that higher dose produces brain swelling and even bleeding in roughly 1/3 of the patients that received it. So all of this data went to the advisory committees, which are not part of the FDA. They're independent advisory committee that works with the FDA. They came back, I think, at least twice and said, no, we need more data. And it's not ready to go to market. And then it has been approved anyway. Unfortunately, when they approved it, rather than limiting it to that smaller group of patients, and these are people early in the disease who are just starting to show signs of amyloid accumulation, they approved it for all and any Alzheimer's patient. And we pretty much know it isn't going to work in those people that have moderate to severe disease, yet the pressure is going to be fantastic. The other thing is the guesstimate right now by Biogen is the drug is going to cost $56,000 a year, and that does not include the administration fees. It's given IV once a month. That doesn't include the MRIs that are going to be needed to monitor for brain bleeding or the PET scans to demonstrate how much amyloid you have and how much is disappearing or not. So the cost is going to be extremely high. So that's it in a nutshell. And I know I sound negative because I am a little bit negative, but I'm also speaking for the Alzheimer's Association. So it is a positive in the sense that we do have new drugs coming on the market. Enormous. Between the drug companies and insurance companies, they rule the world. So.
You say 6, 7, 8 hours of sleep a day. Does that include naps?
The question was that 6, 7 hours of sleep per day. Does that include naps? I suppose it could, if it's a good quality nap.
Along that same line, there was specificity attached to a number of things. However, there was a generality, don't drink excessively. What the heck does that mean?
Well, what does that mean? That means that women should limit themselves to 1 drink per day. And that actually is, I don't remember the exact ounces, that's so many ounces of beer versus ounces of wine versus a shot of whiskey or other hard stuff. Men, it's always been 2. But it seems like recently I saw a recommendation by some group at least that should actually be reduced to 1 per day as well. So a little bit is good, but anything when you start to creep up to a couple to 3, 4, et cetera, more, whatever it is a day, then you're getting into uncharted territory, and for many reasons, but that's one of them. Of course, it's another huge risk with drinking is falls, and falls in older people lead to fractures, and fractures lead to big problems. So, there's many reasons. Poor nutrition is usually associated with drinking. We can go on and on and on. The gentleman was asking about whether it's the vitamins or the liquids that you drink with the vitamins that are most beneficial. And I don't want to sound too negative about vitamins, because the calcium and vitamin D, and there are certain substances that are probably deficient in many of our diets, and it is a good idea to supplement those. Again, I think being guided by your doctor or your pharmacist is the best idea. Yes, fluids are important, and many older adults are dehydrated or verge on dehydration. Many times it's linked to urination. I mean, if what goes in has to come out, and if you're having problems keeping it in, then you're not going to drink excessively. With guys, it may be the other way around, but we do have issues there. And so fluid intake is important, maintaining that intake at an adequate level. And we're out of time.